Thank you for joining us today on another installment of Frost & Sullivan's exciting podcast series, highlighting key disruptive technologies, growth opportunities, economic trends, new business models, industry convergence, emerging geographies, and much more. My name's Mike Jude, and I'm the manager for Frost & Sullivan's Digital Health Research Team. Frost & Sullivan defines digital health to be the application of data to the delivery of healthcare using computational and telecommunications technologies to support business process workflow, clinical workflow, and patient data management. The goal of digital health is to achieve better patient outcomes while improving efficiency and containing costs. As you'll note, this is a fairly broad definition and covers a lot of territory. However, if you think of it as the technology that enables the application of data to healthcare delivery, then the overall definition makes sense, and as a consequence, one of the important technology dynamics we are following is the use of cybersecurity to protect patient health information. Recently, we completed a report on cybersecurity in healthcare. Its title is Healthcare Cybersecurity Market 2018 to 2023, Overcoming Barriers to Adoption in the Face of an Increasing Threat. In that report, we predicted a rapidly growing market for cybersecurity in healthcare. This growth is being driven primarily by the need for the healthcare industry to address an alarming trend of serious breaches that are disclosing literally millions of healthcare records each year. This year, for example, there have been 196 reported security breaches in the U.S. for the first half of the year alone that compromised over 6 million patient records. As we discuss in our report, we fear worse things are in store. We predict that within the next year and a half, there will be a single significant event that will galvanize public policy to impose stringent new regulations on the healthcare industry. We still believe that this is likely, and with healthcare becoming a central issue in the upcoming U.S. presidential elections, the potential for some legislative action becomes even more probable. The question is, to what extent will the industry improve its performance in cybersecurity in the absence of new regulation? As our report discloses, simply increasing the spending levels for cybersecurity will not be enough. In fact, healthcare has been underspending on cybersecurity for some time. And although the last Health Information Systems Society, HIMSS, survey of healthcare IT professionals indicated that generally the market plans to increase its spending, it is still behind most other market verticals, with spending amounting to only about 6% of IT budgets. The average across other verticals is over 12%, and the threat is increasing year over year as bad actors become ever more sophisticated. In fact, the value of healthcare records on the dark web is very high. Unlike other forms of personal information, patient health information has the potential to compromise not only a person's financial information, but personal health details that can constitute the source for coercion or public humiliation. Consequently, the impact on a healthcare organization that does not protect its patients' data can be profound, up to and including business failure. And with the government agencies more willing to punish companies that do less than the required steps to protect such data, the alternatives to good cybersecurity are becoming increasingly painful. So what's to be done? There are a number of options open to health IT organizations, as we will explore in the next podcast on this subject. One of those is to simply divest the healthcare organization of direct management of cybersecurity by utilizing a managed services company. On that note, I hope you have enjoyed this session. Please join us for future podcasts, and to know more about our growth partnership services, reach out to digital@frost.com. Thank you for your time.